Assalamu alaikum. I'm Dr. Tahmina, and today I will talk about cross infection control in a dental clinic. Acha, before I start my topic, I would like you to subscribe my YouTube channel. Okay, talking about the cross infection control, we should consider the guidelines which are provided by the CDC, Center of Disease Control guidelines, and I will probably speak about the new dentists or the younger colleagues who are new to this field and who want to know about the cross infection control. So 100% sterilization protocols and 100% cross infection control are somewhat near to impossible, but we can try our level best to be nearest to the 100%. Okay, starting about the cross infection control, we will talk about the personal equipment, the equipment that will be at the dental clinic, the surfaces, and starting from the hand washing. Okay, hand washing before starting the procedure or before attending the patient, or before wearing your gloves, hand washing, and after attending the patient you have to wash your hands or sanitize your hands. Or it is always better to focus over the hand washing, but if the hand washing is not possible, or then you can use the sanitizer. Okay, so starting from the first point, the immunization. All the doctors, they must receive their immunization of the hepatitis B vaccine and the other vaccinations that are such MMR or other vaccines, influenza vaccine. So the healthcare professionals, including the dentists, the staff, the nurses, who are in exposure to the patients or the community that is working in the dental clinic, they may be in direct contact with the patients or indirect contact with the patients. The people who are working there in that environment, they are also prone or they are also exposed, so they must be vaccinated. Okay, the vaccination, immunization, and then the equipment should be fully provided. All the surface disinfectants, the personal equipment, the health care professionals, they must be provided with the gowns, mask, head caps, and all the barrier techniques, they should be followed. So now I will just consider the stepwise consideration of the cross infection control in a dental clinic. All the dental clinic surfaces must be sterile or nearest to sterile. There must be proper fumigation. End of the day, there must be fumigation in the clinic. The surfaces should be cleaned, and all the surfaces, they can be cleaned either with the help of spray or surface disinfectant, such as the a piece of gauze or cloth that is dipped into the disinfectant solution, and the surfaces must be wiped with that. So all the healthcare professionals should have all these steps in on their fingertips. The new dentists, especially who are just new into this field, they must understand and they must know about all these steps that are to be followed, and they should consider them on their fingertips, as well as not they should not keep it to themselves, but they should train their assistants. The assistant is also in direct contact with the patient, because he is just by side of the patient, all the aerosols and everything, and he is equally exposed as the dental professional is, and the staff as well. So we will start from the beginning, that is the immunization. After the immunization, we will start from the attending the patient. For attending the patient, when the patient comes inside, that we experienced in the last COVID days, that the patient should be screened for all the illnesses, especially the influenza and the viral diseases and all the infectious diseases and transmittable diseases, tuberculosis especially, and the patient should be also giving proper history about hepatitis B, C, tuberculosis, all these. So most of the patients, they don't know about their screening of hepatitis, or there are a very large group of patients who just hide these things because they just think that they will be picked and they will be just not treated properly or not attended properly. Due to that fear, they hide this hepatitis history, B and C hepatitis history. So that should be considered. Okay, after proper screening of the patient or proper history of the patient is seated. Whenever the patient is seated, the dental professional should be taking care of the barriers. Barrier means that you will never be in direct contact with the patient in anything, either skin, either saliva or blood, or any kind of contact that is not allowed to you. Okay, there must be a barrier. A barrier may be in the form of your gown or attire or overall or a covering that is covering your body, or scrubs, and the gloves. You must use gloves. The examination gloves are used for the checkup and examination, and the surgical gloves are used, which are sterile. Surgical gloves are used for the procedures. And the head should be covered so that you should be kept safe from infection, and you can take these infections home and transmit them to your family or children and the entire population. Okay, so the barrier techniques. So you must have proper barriers. The patient that should be attended, you should have a proper gap, should not touch the patient directly. There must be a barrier. Whenever taking a procedure, there is aerosol. To reduce the infectious aerosol, the droplets that are suspended into the air, they remain there for quite a lot of time. You must have negative pressure ventilation in your operatory. There must be a cross ventilation or negative, preferably negative pressure ventilation in the operatory. The aerosol, to reduce the bacteria or the viral or any organism that is suspended into a droplet, to reduce their number, it is better that after seating the patient, you should ask the patient to rinse mouth with a disinfectant solution or chlorhexidine mouthwash for at least 30 to 60 seconds, so that everything that is in his mouth, the oral flora, the bacteria and organisms, they must be at least cleansed from the mouth. After cleansing the mouth, then you start the checkup, and then you start the procedure and the aerosol. So to reduce the bacterial load, one is the rinsing of the mouth. Secondly, you should use rubber dam. Rubber dam will also reduce quite a lot of organisms number from the aerosol and from the transmitting the infections. Okay, rubber dam. The third point that is necessary is the high evacuation or high suction or high power suction must be used to reduce the aerosols. After doing the patient is attended and the procedure is over. Okay, you change your gloves and you wash your hands. All the surfaces must be disinfected with either a disinfectant spray or either the solution that is prepared, and the gauze or a piece of cloth that is dipped into it, and that this is up to you, this is your choice. There are different types of solutions of different rates and categories, they are available. My personal choice is spray is easy for me, and I prefer the surface disinfectant spray. All the surfaces must be sprayed. All the barriers that were provided to the dental unit, so they must be changed after each and every patient, and the operator should wash the hands before seating the next patient and gloving, and this should go on.